lights are bright from up here. I'm glad you get to do this. I want to welcome you this afternoon to the much delayed in-service seminar of the Greater Dayton Stephen Ministry Network. My name is Jean Hubbard. I am one of the leaders on the leadership team here at Fairhaven. And I think you might hear me better. I think you might if I leave this down while I speak. Our first speaker this afternoon, Josh Eglin, is a licensed social worker, and he's the LGBTQ program liaison for Daybreak Dayton. It's a nonprofit agency that serves at-risk and homeless youth. The work done by Daybreak is geared toward empowering and assisting at-risk youth in resolving homelessness, helping them obtain stable employment, increasing their independent living skills, and connecting them with relevant mental health supports and resources. And his presentation will include relevant contemporary research in the field of gender health and science, statistics on LGBTQ+ young people, and evidence-based feedback on how to navigate challenges with individuals and families encountering these. Stephen Ministry is looking at this topic because while we don't deal with care receivers under the age of 18, we do frequently assist them or their parents. And so we need to just be a little bit more knowledgeable, either comfortable that we're already up to date, or like me, maybe finding out for the first time what all is going on now in the culture in the 21st century. It's my extreme pleasure to introduce now Josh. He, while his organization is not tied to a particular denomination or affiliation, he most certainly can answer our questions from a Christian point of view. If you have one that is a question that's directly related, he won't step away from it, he'll answer it, I am assured. It's my pleasure to introduce Josh. Where are you? There you are. Thank you so much.
Thank you, Jean. I really appreciate it. Thank you so much. Thank you all for being here this evening. I am going to amass just for the benefit of y'all being able to hear me, and we have good distancing here, so thank you everyone for coming prepared and for your participation in this event. So as Jean introduced me, I do work at Daybreak Dayton. I work with youth that are primarily aged 18 to 24, but we also work with some minor age youth that are engaged with our shelter services. We provide respite services for families that are experiencing discord where they need a bit of a cooling off period. So that is a service that our shelter provides. And there are times where we as well are working with parents who are navigating different challenges with the identities of their children, the way that they're communicating, and different issues that can arise in this day and age, and just in the way that young people express themselves. So I'm really happy to be here this afternoon and happy to hopefully answer some questions. But to begin, I'd like to go over a bit of a presentation that I put together here. So if you could advance to the next slide, please. So I think it's really important that no matter what the subject is, we always have to consider that when we're looking at communication, when we're looking at dynamics in a family setting or in any kind of setting, perspective is crucial, because we're talking about content often, you know, when we're communicating with our children or our community or our peers, whatever, but we're also looking at the different lenses that each of us bring to that conversation. And so, you know, perspective is defined by Merriam-Webster as, you know, mental viewer prospect. It's the interrelation in which a subject and its parts are mentally viewed by us as individuals, but it's also the capacity for us to view things in their true relation or relative importance. And those two things are really important here as well because as we'll get into in the course of this presentation, sometimes our values, our perspective is informed by pieces of information or knowledge that youth don't have, and vice versa. There's sometimes things that youth know and they bring to the table and they have knowledge or understanding of things that are going on, TikTok or YouTube or whatever that I have no idea about. So I need them to inform me about those things. And we learn from one another. And a lot of times, like you can see in this little cartoon, I might see something as a U. Someone else might see it as an N. But there's this shape that's shared in there. There's something bigger than maybe our individual interpretations that we're all trying to get at. Next slide, please. So it's really important to consider values as part of our perspective, I think, because it's really crucial for us to have shared values. This is part of what shapes our community. This is part of what shapes a church community or even a local community. There's times where these values are going to inform our expectations and our perspective of young people and of our peers. And I think it's really important for us to question, to challenge ourselves sometimes. How is this beneficial? When are my values enhancing the lives or enhancing the experiences of our young people? So for instance, you think about like budgeting. I was terrible at budgeting. I needed someone to coach me on that. That's something that I needed to develop and cultivate as a life skill. So my dad having really good budgeting skills and having that as a core value really helped me as an individual grow and develop that skill on my own. There's also times, and this is, I think, something that we are challenged to talk about at times because it requires sometimes challenging our own assumptions about our competency or even our own knowledge or our own scope of awareness and understanding. But are there times where maybe our values actually interfere with our ability to connect? Where maybe because our value is just so strong and so integral to our viewpoint, to how we're looking at the situation, that it can get in the way. So as you can see in this cartoon here, I don't know if you can read it up there. Oh, it's kind of pixelated. So there's three different perspectives here. There's the person on the left saying, oh, nothing could go wrong. Person in the middle saying, oh, there might be a slight snag or two. And then you have the catastrophizing person on the right. This is more often than not me. First the oceans will rise, then the skies will fall, then all these things will go wrong, right? We have this perspective sometimes that can be very catastrophic, and it can get in the way of communicating, of connecting. Next slide, please. So this is an image for some of you might have seen the Pixar movie Inside Out. It's a really wonderful film if you've not seen it. I actually have used it in different therapy groups before because there's just so much insight that you can glean from that film. But what we have here on the right side, or left side as it were, of the screen, is you see fear. This is the emotion of fear. And it's something that we all experience. And I think it's also sometimes a reflection of our love. It's an expression of our love. Because think about it. When you really love someone, there's times where you're going to fear for their safety. You're going to fear for their well-being. You're going to have this emotion that is kind of a protective emotion, a reflex that we have. And it can be that. It can be protective. It can be connective. But then we also have to, I think, ask ourselves at times, when is it getting in the way? When is it pathological? I'll give you an example, for instance. If I am concerned that my child is dressing differently or expressing their gender in a really unique way, and I'm worried that they're going to get singled out and harassed at school because of the way that they're presenting, right? That's a fear that I could have legitimately as a parent for my child. And there's a concern for my child. There's a love for my child in that fear. On the other hand, if I were to be fearful that, for instance, well, what are the other parents going to say? What are the teachers going to say? What are people going to think, right? Is that as grounded in the love for my child, or is that more grounded in my own self-consciousness or my own worries about what other people are going to fear and think? Does that kind of make sense? So fear is something that can be very powerful. And I think that, it's a challenge to know when it's helpful and when it's a hindrance. It's something that we're all going to face individual challenges, I think, at different points in our life. I know at least firsthand I have. And this, I think, begs this important question. Can faith and reason coexist? Which is, on the surface you might think, well, duh, of course they can coexist. I think for a lot of us, though, it's a challenge because we're torn between either or at times. Is my connection to my God or my connection to my faith and my spirituality more important to me than my ability to think through in a reasonable or in a logical human way how different situations are going to play out? Do I have to choose between the two? So we have, the both and versus the either or perspective. I could say, okay, faith is going to win out all the time, and it's at the end of the day the most important piece, which is obviously understandable. I could also take the other extreme, as a lot of individuals I think in our society have, where reason is more important and reason is going to win out all the time. And I think in both of those perspectives, this is my personal bias here perhaps, but I think that we miss out in both of those perspectives on something. We miss out on the possibility that maybe it could be both and. Maybe we can use reason as part of our guidance and recognize that maybe that's part of God's intent. Maybe that's part of the design, is that we have the ability to think, we have the ability to reason, and that can be to our benefit. So we think of, for instance, Blaise Pascal. For those of you who aren't familiar, a 17th century French mathematician. Blaise Pascal said, "Love has reasons which reason cannot understand." And I think there's a lot of truth in that there are layers of understanding to love, layers of understanding to our spiritual connection that we don't find in reason. And vice versa, there's some things that we find in reason that we don't find in love. So is it possible for us to maybe reconcile, to keep those two thoughts at the same time as important, as equally meritable of our attention? Next slide, please. So we're going to look into different aspects of gender identity because this is something that I think we're starting to understand in a more nuanced way in our society, but it's also something where there's a huge gap. I'll even tell you, for instance, I go and do a similar presentation at juvenile courts on Thursdays and sometimes Wednesdays for their evening reporting center. And with some of the young people in those settings, they have great knowledge of different biological research revelations, different aspects of gender science. And then there's some individuals that aren't getting any of that information. And there's this huge gap, and it sometimes results, I think, in conflict and tension that could be resolved with just a little extra understanding, a little extra knowledge. Next slide, please. There's three basic components to every individual's gender, and we're going to kind of break this down over the course of the next half hour or so. There's our sex, our biological sex, which is our hormones and our chromosomes. There's our gender identity, which is, as we're going to dive into, the way that we identify and align with our biological sex. There's also our gender expression, which is, for instance, the external piece of our gender. So, I look around me and I see different people wearing different things. Some things look more masculine, some things look more feminine, and that represents our gender. I'm wearing a button-down shirt and slacks, which is more masculine expression. Next slide, please. Our biological sex is defined by the 23rd pair of our chromosomes, the chromosomes in our DNA. And we're accustomed to, for instance, seeing XX and XY as two kind of very commonplace and commonly accepted types of biological sex, XX being a female sex and then XY being a male sex. But we're also starting to understand that there are other combinations, that it's more complex sometimes than what we've thought or understood in the past. That there's some individuals who have an extra X chromosome, some individuals have an extra Y chromosome. There's different combinations that we have identified in biological research. And also in the last couple decades, we've identified that it's really complicated in terms of how an individual egg, after fertilization, develops into the biological sex that it's going to express. They've identified that instead of previously that Y chromosome theory, which dictated that whether or not the egg was carried longer or trying to think of the correct word to use here, whether or not the egg developed longer, it would develop the Y chromosome, which would express as male. And they even would joke it's the overcooked egg theory. So all eggs started out as female, but if the egg was developing longer, it would develop this Y chromosome. Instead, they're seeing now through biological studies, which is really fascinating, there's two different networks of competing gene activity going on in there. We could even call it, for instance, the masculine network or a feminine network, or however we would want to label those two networks. But they're actually shaping the course of that egg as it's developing. And the combinations that come out of that activity, that network of gene activity, are a lot more nuanced and complicated than what we previously thought as being just XX or just XY. I know this is kind of like some complex things to marinate on, but bear with me as we dive into it because we're going to explore a couple exceptions to our common rules that might challenge and open up some different possibilities of understanding for us. Next slide, please. So we all have a combination, a unique combination of these three hormones. We have all kinds of different hormones in our bodies, but these three hormones really are crucial to informing how our biological sex is read and how our biological sex is expressed. So we have progesterone, estrogen, and testosterone. We know that progesterone and estrogen are typically linked with female sex. They're more feminine traits historically that we associate with those. The more scientific understanding or the more specific things that we see when it comes to estrogen is there's a higher level of certain emotions. For instance, it's not uncommon for someone who's experiencing high levels of estrogen during pregnancy to have uncontrollable bouts of crying or uncontrollable fits of strong emotion. There's also a similar parallel, shall we say, emotional component to testosterone. Testosterone is linked to higher levels of aggression. It's linked to higher levels of intensity. And we see this, for instance, in different athletes who might actually use different performance-enhancing drugs to try and increase that part of their performance. And we also have seen through hormone replacement therapy, for instance, what's done for individuals experiencing menopause, for individuals experiencing different hormonal imbalances, that a lot can be controlled and a lot can be dictated by the amount of hormones that we have in our bodies. So when we consider what we're about to dive into with the different parts of gender, I want to just encourage everyone to consider this biological piece as being a really important part of the puzzle. These chromosomes and these hormones really dictate a lot of how our gender is seen and expressed. Next slide, please. So, based on external anatomical traits, most of us get assigned a sex at birth. And this is really important as well to consider that this is based almost exclusively on what we can see on the outside, which may or may not be very clear-cut. For instance, we've talked about male and female biological sex, but we haven't really dived into this other piece as a culture, I think, as a whole, to really understand that a large number of individuals, a large number of infants are born every year in a different category altogether. They're born with some anatomical traits that are more masculine, some anatomical traits that are more feminine. And they're identified as intersex or other oftentimes. Historically, as we're going to also hear in a story that I'll read from Ruth's story here in a little bit, this is something that doctors would try and determine concretely at birth by doing a surgery that would assign a male or a female sex specifically to that child. And a lot of times what we found is those surgeries were not medically necessary, meaning that the child is actually capable of functioning biologically fine. It's just that we have these expectations, right? When someone's pregnant, you ask, is it going to be a boy or a girl, right? We have these expectations and these strong cultural expectations to go into one of those two categories. And sometimes we're challenged by what we see in nature, by what we're seeing in creation, that this is a little bit more complicated. So the prevalence of intersex births is roughly estimated at 1.7%. And that's approximately the same percentage of individuals born with the gene for red hair. When you think about that, that's a pretty high prevalence among our individuals. If we have, for instance, a school that has 500 students in it, which is not uncommon for a big high school. There could be 5 to 10 individuals that are in a different category than that male-female thing altogether. There could also be other individuals, if you'll advance to the next slide, please. There's other individuals where those chromosomal variations that reveal that that individual is not XX and not XY either, that they're in a different chromosomal combination. Some of those variations are not going to be physically apparent at all. Only through genetic testing would you actually be able to identify that that individual has a different chromosomal makeup than XX or XY. So we see here a picture of participants at the 3rd International Intersex Forum in Malta. This is an example that I bring up with this photo here, so you can see that these individuals all look like individuals that you might see anywhere. And we don't know just by looking at this photo how these individuals identify for their gender. All we know is that they were either assigned intersex at birth or identified at some point in their lifespan that they are intersex. Next slide, please. So we're going to now talk about the evolution of gender beyond that starting point, because a lot of things happen during adolescence, and that's really what we're focusing on in this session and in this afternoon, is looking at how adolescent development can sometimes be challenging, not just for us as parents or us as the community that's working with adolescents, but also for the adolescent themselves, for the individual that's experiencing all these hormonal changes and going through all of these internal biological changes. Next slide, please. So I'm going to read Ruth's story. Ruth, who is now 60, spent much of her youth questioning constant medical attention that she was receiving, including surgeries, which she received in her early childhood in the 1960s. Doctors always deflected my questions and stonewalled me when I asked why I had so many appointments, she said. I developed PTSD and dissociative states to protect myself while they treated me like a lab rat, semi-annually putting me in a room full of white-coated male doctors, some of whom took photos of me when I was naked. Ruth attended a private university, started a lucrative career, and got married to a man. One night when she was 32, she hemorrhaged while having sex, so she rushed to the hospital. Ruth told the Human Rights Watch who interviewed her for this story. After my emergency surgery, I had my first encounter with a truly compassionate and candid doctor. He told me, I'm not sure what you have, but if I can see your medical records, I can explain it to you. Ruth drove to the office of the endocrinologist who had treated her throughout her childhood and requested her records. He said no, so she waited in the parking lot until he left that night, broken and stole them. I just sat in the parking lot and didn't even read them at first. I just put them in date order, Ruth said. Then I took a breath and started reading, and the first thing I saw on the first page was male pseudohermaphrodite, complete female phenotype. Patient does not know diagnosis. Thoughts rushed through Ruth's head. First I thought, this is great. This is a known thing. How freaky does it make you feel when they say there's no one else like you and no name for your condition? The second thing was, these people lied to me all the time. There are other people out there like me. I wish I had known there were others like me. I was totally enraged that that had been kept from me. Why would you deliberately try to make a person feel like a freak? And then I felt, this feels good. I've got the knowledge, and they can't hide it from me. I can protect myself now. And then I thought, I wonder how much Mom knows. Did she know this? And was she part of a keep it from Ruth thing? Ruth confronted her endocrinologist the next day. He said her mother had asked him not to tell Ruth and that he was just following the standards of care. Ruth said, that was when I realized that this way I was treated was never about me. It was about my doctor and my parents, and everyone feeling uncomfortable with how my body was. But I want to be like nature made me. So when we think about Ruth's story, and we go back to this notion of perspective, we see that there were certain perspectives that were taken into account in the decision that was made about Ruth's surgeries and the way that Ruth was raised. But there was one important perspective that was left out of that conversation altogether. And I think we all know whose perspective that was. It was Ruth's. Ruth did not have any say in this process. And when we think about Ruth's story and other stories like this, that there are unfortunately many others, the worst part of this from my perspective as a clinician, as a provider, is the breakdown of that family dynamic. You think about how many tensions exist in that dynamic when something is kept from a child and they discover it later on, and how you do restore that trust within that family. And I don't know whether that was ever accomplished in Ruth's dynamic or in Ruth's family dynamic. But I think that her story gives us a reason to maybe think more critically or think more roundly about the choices that we make when it comes to our young ones, the choices that we make when it comes to the way we raise our young ones, and whether or not their voices are taken into account. Next slide. So when we look at gender identity, we're looking at one's innermost concept of self as male, female, a blend of both or neither, how individuals perceive themselves and what they call themselves. One's gender identity could be the same, and it could be different from their sex assigned at birth, based on the fact, for instance, that Ruth was assigned one sex at birth, but we don't know if that's really how they identified. Perhaps the design of Ruth's being was to be neither, or to be in a different category, because that's how Ruth was born. Next slide, please. So we have some terms here that some of you might be familiar with, some of you might not be familiar with. So we're going to take some time to just kind of walk through them, because as a provider working in social work, these are things that are becoming more and more commonplace, especially when we are working with young people in the way that they express or understand their gender identity. So cisgender, or cis, is a person whose gender identity aligns with the traits typically associated with that sex assigned at birth. And this might seem like a complicated wording, but I'm going to break it down a little bit and use this specific example. What do the colors pink and blue mean to you when you think about gender? Boy or girl, right? What if I were to tell you that it used to be pink was the male color and blue was a female color? It was originally assigned in a different order, and by marketing executives, people who wanted to profit a little bit more out of selling more product in a different color combination, they decided to flip the branding of masculine and feminine attire so that blue became a masculine color and pink became a feminine color. So those traits are associated with just a decision that we make as a culture, right? It's a decision that we make as a collective, and some of us might be more or less involved in that conversation, but it's a decision that could be kind of arbitrary, you know? When you think specifically about other cultures, for those of you who've traveled abroad or been in other parts of the world, we see many different combinations of expressions of gender. I was just talking to Sandy previously about how I was raised by missionary parents overseas, and we were living in Italy. And there are many different things that we might see as feminine in our culture, but would actually be very masculine in Italian culture, and vice versa. So there's many ways in which gender can also be codified within different cultural norms, and it's part of how we express and communicate. Transgender, or trans, is an umbrella term for people whose gender identity or expression is different from those cultural expressions. So if someone says they're trans, it may or may not mean that they identify with the opposite sex of how they were assigned at birth, but it does mean that they don't identify explicitly with how they were labeled as a child. And it could, for instance, be true to Ruth's story, that being assigned female at birth, Ruth, even though she doesn't specify it in her story, may well identify as trans, as something other than that. And that's just the way that Ruth is expressing her experience, expressing her truth. We also know that other cultures, for instance, Native American culture, has a different category altogether. Two-spirit people historically were assigned different roles, specific tasks within the tribe. Some of them were intersex, some of them were just identified as two-spirit by the tribe or by that individual. Some tribes even had a two-spirit masculine and two-spirit feminine, so there would be 4 genders within that tribe. And this goes back millennia. I mean, we're talking about very ancient modes of expressing gender. Next slide, please. So these are some gender identities that I encounter all the time, for instance, when we do intake and we're collecting different data at intake with individuals in the service spectrum. They may identify as male, they may identify as female, they may identify as two-spirit or non-binary. And non-binary simply means that they're neither nor, or maybe both and. Maybe they were born intersex and they align with this other expression of their gender, and they're okay with that. And they just express it using that term. We also have this trans term, which could be a trans male, could be trans female identified, could also be someone who simply uses the word trans, and they say, I'm trans, and that's their choice. Next slide, please. So gender expression, unlike gender identity, is the external appearance of one's gender. So if we look at gender identity as being that innate internal knowledge, like I sense that I'm masculine, for instance, and I identify as male, and that's something that I sense and align with, then I may choose to externally appear that way as well, to express myself in that way, using specific clothing or voice or whatever that expresses that masculine identity. Next slide, please. This is a term that is also sometimes found inside the social service spectrum, inside the individual experiences that people share when it comes to identifying as trans or non-binary. But not everyone experiences this, and this is a really important piece of the puzzle, I think. Gender dysphoria is defined as the feeling of discomfort or distress that might occur when people whose gender identity alters from the sex assigned to them at birth. So for instance, it sounds like in Ruth's story, there were times that she may have experienced this, where she sensed that there was something wrong between the way that she felt and the way that her body was after those surgeries, and the way that she actually felt at birth, the way that her hormones and her chromosomes actually were telling her on the inside, this is who you are and this is how your gender is. And that created this distress, this tension, which we call gender dysphoria. But again, not everyone is affected. There's some trans people who might never experience this distress. Some individuals who identify as trans may say that with or without any kind of surgery or hormone treatment, they feel at peace with their body and their being. And maybe, with genetic testing that they may or may not have done, we would identify that they have a different combination of chromosomes than XX or XY, and maybe that's how they're expressing it. But nonetheless, we have to be mindful of the way that people communicate themselves, which is what we're going to dive into in this next section. Next slide, please. So what if a child says they're trans? Well, as a wise person once told me, life is a journey. It's a ride that we all take individually, and we take it with our families, we take it with our community. And when someone comes out as trans or reveals a part of their identity, they're revealing something that's really important to their journey, something that is really maybe intimate and personal to them. And they're trusting their audience with that information. And unfortunately, there's many situations where people express this and they say that, I identify as trans, or I don't think that, I'm what they said on my birth certificate. A lot of times the first response is, that's not possible. We need to put the kibosh on this because, what will the neighbors think? And this is not something that I'm comfortable with. Well, unfortunately, it's not always a choice for the individual who's experiencing that. And as we saw from Ruth's story, there could be some very specific reasons why the individual is feeling that way. listening is always an option. And as a social worker, I find that open-ended questions are really important and really valuable for maintaining connection. Remember, we talked about how fear can sometimes drive us to disconnect or to disengage from an uncomfortable situation. But if we're able to stay in that discomfort for a little bit, then we might find a way to connect and communicate, and a way to express our fears and our concerns without completely closing the door to that individual. So what does this mean to you, we could ask, or what do you need from me? Next slide. So one common thing that a lot of folks who identify as trans will share is that they get misgendered a lot, meaning that someone may refer to them as ma'am, but they identify as sir, or someone may say he, and they prefer to be identified as she. The reality is that I think sometimes, we live in a very sensational culture and our media can be very sensational. A lot of the trans folks I work with, this is very low on their priority in terms of what they experience. A lot of folks who are trans experience discrimination in housing. They experience harassment and physical and verbal assaults in many different settings and situations. So they get misgendered routinely. And sometimes we can find ourselves actually taking it more seriously than they do. What I encourage everyone to consider when it comes to using pronouns that people use for themselves, for instance, I use he, him, his pronouns, is that it's a way to respect the individual. It's a way to communicate and express our respect and our understanding for where they're coming from. And in that way, it can be hugely impactful and hugely connective in helping us stay engaged with that person. So for instance, next slide, please. We have pronouns that are feminine, she, her, hers. We have pronouns that are masculine, he, him, his. And then we also have gender-neutral pronouns. And unlike Latin-based languages, European languages, which usually have a third-person singular gender-neutral as well as a third-person plural gender-neutral, the English only has a third-person plural gender-neutral, they. So we've, in our culture, and Oxford Dictionaries actually embrace this now, as a third-person gender-neutral singular or plural. But we use they for individuals many times who identify as non-binary or identify as intersex or other. And so that he or she binary doesn't really express their truth, and it doesn't really respect their truth, their identity. There are also these less common gender-neutral pronouns, but I include them here because you may encounter them, and different young people may identify by z, zers, zers, or z, here, heres. But again, I encourage you to consider that even though you might see this amplified in different ways in culture, a lot of times this isn't going to be the first concern. But if you do use the pronoun that that person chooses for themselves, I think you will find that it can pay off in dividends in terms of the trust that you're generating and the understanding that you're exploring with that person. Next slide, please. So I also think it's important to consider that there are many youth who are trans or LGBTQ that are really ostracized because of the way that they're treated, the way that society or their community responds to their expression of their gender identity. And we see this as yielding some really frightening and startling statistics, I think. Again, even though our culture blows a lot of things, I think, out of proportion, we do see that more millennials identify as LGBTQ than older generations. That doesn't necessarily mean that older generations may not have identified at the same percentage, but it is becoming more commonly accepted and understood. So I think we're seeing a lot more individuals coming out, even at a younger age. So we see about 8.2% of millennials identify as LGBT. But statistics indicate that LGBT youth comprise 40% of the homeless youth population. So there's a huge gap there, right? Because if we think about the homeless youth population as representing different identities, we should only be seeing about 8.2%, or 10% maybe at the most, identifying as LGBT. But we see a much larger percentage of LGBTQ youth in the homeless service spectrum. And the common reasons that we see the two most common reasons, in fact, are family rejection and abuse. Those are the two things that are highlighted in study after study and report after report as to why young people experience homelessness to such a disproportionate rate for the LGBT versus the non-LGBT. Next slide, please. So we also, unfortunately, see a lot of suicidality within young people across the board, and we see higher rates of suicidality within LGBTQ young people. So half of transgender individuals responding to the latest survey on LGBTQ mental health reported contemplating suicide during the previous year. We also know that youth who undergo what was known as conversion therapy and is still practiced in different sectors in different ways are more than twice as likely to commit suicide as those who don't undergo those therapies. LGBTQ youth who report having at least one accepting adult in their life, just one person that is willing to listen to their truth and understand or try to understand and connect to that, they're 40% less likely to attempt suicide. Think about that. Just one person, if one person had sat down and listened to them, that might have made a huge impact in these individuals' lives. Next slide, please. So I want to close on this and then take some questions if anyone has any questions. But I think it's important to consider the golden rule and the platinum rule when we look at the way we treat one another and the way we understand each other's identity and the way we express ourselves. So we have this interpretation of Matthew 7:12, which is not verbatim. You know, we've loosely adapted this for our cultural purposes. Do unto others as you would have them do unto you. All right, we've probably all heard that at some point in our life, the golden rule. We also have Dave Kirpin's expression of this rule, which is kind of turned on its side in a way. He wrote this book called The Art of People, where he said, maybe if we look at it this way, we'll get a different result. Treat others as they wish to be treated. It's close, but it's a little different, right? Because I'll give you an example. I work, again, with a lot of young people. Young people have very high anxiety. I don't know if you've experienced this, but high anxiety levels talking on the phone. It's something that young people just don't do. They do this all the time. You know, they communicate on Facebook, but they don't pick up the phone. So I'm a phone guy. Like, you know, I still talk to my friends on the phone. My mom lives in Mexico, so we talk on the phone all the time or do a video call, whatever. But when I'm working with young people, if I call someone to schedule or confirm an appointment, the chances of them responding and returning a voicemail are very, very slim, right? But if I text them, I'll get a response right away. Every time. And I'll have emojis and I'll have hearts and all sorts of different things in it, right? But that's their way of communicating. That's the way that they want to be treated. So by allowing myself to open up to that, even though I think sometimes, come on, can't you just pick up a phone, you know? But by allowing myself to open up a little bit to how they think and what their priorities are, I could really increase the connection that I have with that individual. So again, if we think about that either or versus and both perspective, is it possible that both of these rules could maybe be useful at different points, right? Maybe there's times we're using this golden rule and thinking about how we want to be treated and reflecting that for someone else. There's times in situations where I think that can be really helpful and really crucial to helping each other grow. And then there's maybe times where it's okay for us to step back and set aside our expert hat for a moment and just listen to how someone is expressing themselves. Those open-ended questions again. What does this mean to you? Tell me about this. I don't understand this. Can you please just enlighten me? Give me a little bit more information. And we might get a lot out of that. So next slide, and I think it's just a question slide. I'd like to open up if there's any questions. I know there's some folks on the Zoom call as well. Anything that you'd like to know more about or anything that was unclear? Not all at once. Yes?
Yeah.
So I get my exercise.
We know that youth often try on new personalities and ways of being. And I was wondering if you had any information on what percentage of youth kind of try on an alternate gender expression at some point and then sort of go back to a more traditional gender expression over time?
That is a great question. Absolutely. So Sandy asked a really valuable question. What percentage of youth who identify as gender nonconforming or identify as trans later wind up maybe reverting to their identity earlier? I honestly don't know the percentage for that. But as a provider, my thought is, I don't know that it makes a huge difference either way in terms of the work that I'm doing. For instance, if a youth comes to me and says they identify as trans feminine, and maybe they look more masculine or were assigned male at birth, well, I don't have anything to lose by just respecting that that's where they're at right now, right? I could just listen and say, okay, you prefer to use maybe she, her, hers pronouns, and this is your expression of your gender, and we work with that. One thing that I see all the time in working with young people is we're always working with resistance. And I think one underlying component of this question that's really important is that there are going to be times where young people rebel or they do something for attention or they act out in a way because they want to get a certain response. And I'll tell you, every time the response that is going to deflate that the quickest is acceptance. Because they're expecting a fight, they're expecting resistance, they're expecting you to be like, you can't do this, right? But if you say, okay, you may see that that deflates very quickly. And if they don't truly identify that way, that's probably going to subside pretty fast because they're not getting the response that they're wanting to get out of it, you know? But when you allow them that space to kind of work through those things on their own terms, you're maintaining that connection. You're maintaining that shared perspective. And hopefully they're maintaining that connection with you as well, thinking, this adult person knows some things, right? Great question. Are there any other questions? Any questions come to my mind?
Can I ask you one?
Absolutely.
Okay. Many moons ago, I went to work in the bank, and I was a teller.
Yes.
And one of the people who came on Friday night was in a lovely flowered dress, but had a male driver's license. And so that was the most unusual time I ever had in my life, and it was a long time ago. How would you have dressed it?
Well, this is a great question when it comes to identities and identification cards. So in Ohio, you can get an updated state ID to reflect your gender identity. There is a process that individuals who are trans or non-binary or gender non-conforming have to go through where they get a physician's letter confirming that they identify by a sex other than what's assigned at birth. And they may have an ID card updated then. So this individual, for instance, and I'm just guessing here because we know that their expression is feminine, but they have a masculine or male assigned at birth sex, correct? So we don't know necessarily how they identify. The only pieces of information we have are their biological sex and their gender expression. And if we think of those three components, the gender identity, the biological sex, and the gender expression, we're missing that gender identity, which is how that person identifies themselves, right? So what I would do in that situation is verify maybe that their address is the same, or verify, there might be a policy within that bank as to how you go through verification, because there's also genuine concern that maybe this is not the right person, right?
The other people I worked with on the staff had met the person. And so I just checked with somebody because I was new there.
Absolutely. And that's doing your due diligence, right? Because you don't want to give out money to the wrong person or something, right? And we have a lot of situations, I think, like that happening. Unfortunately, the one thing that we don't have in the state of Ohio, and this is unique to Ohio and Tennessee, is people who are trans or assigned the wrong sex at birth, so Ruth, for instance, could not get an updated birth certificate in the state of Ohio. Ruth could get an updated birth certificate in Texas or Arizona or Mississippi, any other state except for Ohio and Tennessee. So this is just another example, I think, of how there's just this lag between the science and the research and the knowledge that comes out, and then how we adapt as a society. And that takes time. But through communication, we stay connected and we learn from one another.
My other question is the problem with for them and their teammates when they want to be on the other team for cross country or something where their giftedness makes them superior, and it sounds unfair.
Absolutely. Another very, I think, thoughtful question, because again, there's so many things that are codified by gender in our society. And we think even, for instance, of like cheerleading, right? Historically was like only girls did cheerleading. But now, and like when I was in high school, you saw some guys doing cheerleading too. You saw a lot of different types of individuals getting involved in that sport specifically. But it does create a lot of these questions, right? Because it forces us to challenge our assumptions about the different gender roles, and to also challenge our understanding of how we're defined by our hormones and whatnot. Because there's also, for instance, I remember there were some girls that I attended high school with that were very muscular and could probably take me down in a fight if they really wanted to. And so it could go the other way too, right? Where someone who's biologically female but might have more testosterone in their unique balance of those hormones. And so it could go the other way as well. But it's a very good question, and I don't know that that's maybe the right answer or the good answer that you were looking for, but I think that the question's important, and that's another thing I try to keep in mind at all times. The questions often are more important than my answers, because as individuals in all the situations that we're navigating, we're going to need different answers at different times, I think.
Okay, I'm shielding my eyes from those bright lights.
Okay, I got a question.
Yes.
All right. What is, in your reading, research, and all that, what percentage of youth struggling with their identity, gender identity, is related to either circumstances that have occurred in their life, something very maybe earth-shattering for them emotionally, spiritually, or in like abuse, or also just how you were brought up? I mean, where are we with this as to that kind of a situation where youth are struggling with their identity sexually? I mean, have you come across any findings?
So this is another very, I think, it's an important question, and it's a question that others might brush to the side in my field, but I think it's an important one to consider. Here's an example using sexual orientation that I think is equally important. And so I'm going to answer this question, but I'm going to use a different example because it's a clearer way to express the thought I'm having on this. So bear with me. We, for instance, have historically had fears, doubts within the social service community that individuals, for instance, who experience sexual abuse or experience a rape might have deterrence for that orientation, sexually speaking, and they may be oriented the other way. And this is a fear that we've had as providers or as parents, as individuals. What we do find in those statistics is that there's really no correlation between abuse and sexual orientation, for instance, because there are many individuals who are male, who are abused by a male perpetrator, but do not align that way, or they're abused by a female perpetrator and they don't grow up to have that complication. So there's not a strong correlation there. There is a strong correlation, though, between complex trauma and different mental health factors. What we do know is that based on the research of Evelyn Hooker, who was an Australian psychiatrist in the 70s, and part of how homosexuality, for instance, got downgraded out of the Diagnostic and Statistic Manual and eventually taken out altogether, what her studies found was that there was no difference in adjustment between someone who, for instance, was gay and someone who was heterosexual when it came to mental health conditions. So if someone had depression, the symptoms were consistent across. Similarly with gender identity, we found that regardless of what kind of traumatic background or what kind of experiences they've had, a lot of times the symptoms of those traumas, the symptoms of depression or post-traumatic stress disorder, are consistent regardless of whether they're trans or straight. Those symptoms look pretty much the same. And I've yet to experience, I've worked in this line of work for 5 years, I've yet to see a case where it seemed to me like the individual was trans or non-binary or identified a certain way because of an abusive experience they had. Many times they're expressing these things early on. So for instance, you may see a young boy who's always getting trucks for Christmas and G.I. Joes, but then they go straight to their sister's Barbie doll and is playing with the Barbie doll instead. And you keep trying to give the truck or you keep trying to give that G.I. Joe thinking, come on, you're gonna take this carrot eventually. And the child keeps going in that other direction. And then we just see that that's an internal drive. It's something that's pulling them, and it could relate to their chromosomes, it could relate to their hormones, it could relate to any facet of their being. And trauma could play a role, but we don't see a very strong correlation between trauma and orientation or identity. If I do see research, though, I mean, that would be something that would, again, it's a meaningful question. I'm sorry, I hope that answers.
We're right on the button for our break. You folks are incredible. I want to thank you.
Oh, well.
And
Use your mic. Use your mic, Jean. Thank you.
thank you so much for taking time to share with us.
It's truly my pleasure, and thank you so much, Jean. Thank you, all of you, for being here. This was just a really wonderful opportunity, so I appreciate being given the opportunity.
Thank you. The school teacher in me, it's very well buried, is suggesting a 5, 6, 7, 8-minute break so everybody can have a chance to stretch their legs. And when we come back, Sandy will be presenting on getting along with electronics and children in the same household.
That's an important one, too.
You're welcome to stay.
I do have to go and tend to some things this afternoon, but I would love to tune into his presentation sometime. Is this going to be preserved on Zoom or something? Can it be accessed after the fact?
I'm not sure, but I'll find out and let you know.
All right, yeah. If you...
Oh, thank you. I think we're going to try to get going again. And it is my pleasure to welcome you to the second half of our two-part presentation. And our speaker is Sandra L. Todd. She's a doctor of psychology and an ABPP, pediatric psychologist, and she works for New Creation Counseling Center and the Dayton Children's Hospital. And her presentation to us today is about children and adolescents and screen time. And I think she's talking about this. Okay, and so without any further ado on my part, I want to welcome you today, Sandy.
All right. Okay. Thank you so much. It's a pleasure to be here. Thank you for asking me to come. I want to first start and ask, can everyone in the room hear me all right? Put your thumbs up if you can hear me. Okay. Excellent. Okay. And please don't hesitate to stop me if I am. Oh.
It's very difficult to see your face.
Okay. We'll try this way. All right. Can people still hear? All right. Okay, so I chose to start embarking on researching this particular topic because I see some of you guys have my similar demographic that underneath this dye is gray. And so oftentimes what we tend to think about is what we experienced in our own history as what's normal and what's right and what's good. And as we have seen over the years, the recent years since the genesis of digital media and digital communication, since it's exploded, my tendency has been to decide that it's bad and wrong. And I wanted to make sure that my opinion was backed up, or maybe determine whether it was not backed up by what the research actually showed. So I started to do some research on looking into what we do know about the positives and negatives of digital media and the impact it has on our children and adolescents. So that's what this presentation is about. Next slide, please. All right, so, oh my goodness, I cannot see. So what I want to cover, I have an outline though. What I want to cover today are 4 different areas. One is what are children and adolescents actually doing with their screen time, and how much time are they actually spending on screen activities? Next is what is the impact of that activity that they're having on their functioning? Next, I wanted to talk about what the dosage is of screen time. If we can think about screen time as just like a medicine, is a little bit okay? Is there a right amount? Is there too much? So I wanted to talk about dosing. And then the last thing I wanted to talk about is what guidance you as caregivers can provide to families to help them ensure healthy screen time impact. Next slide, please. So, and next slide after that. We're going to first talk about what activities children are doing. So first I wanted to talk about just I'll skip to dosage for just a brief minute, and then I'll reintroduce that later on in the presentation. But this is the recommendations by the American Academy of Pediatrics. They say that children birth to 2 years old should have 0 screen time. That includes television. Children under the age of 2 should not have access to screens. Children 2 to 5 years old should have less than 1 hour per day. And children 5 to 18 years old should have less than 2 hours per day. Next slide, please. The actual result of what people are doing as of 2014, children under the age of 2 are getting 3 hours and 3 minutes of screen time per day. And that is up from 1 hour and 19 minutes when it was previously tested in 1997. Children 3 to 5-year-olds are getting 2 hours, 28 minutes a day of screen time. So all of them are getting more screen time than is recommended. Next slide, please. So 90% of parents ignore the guidelines that are put out there, and they have reasons for that. One reason is that they lack affordable alternate entertainment, they say. This is what parents are saying. This is all I have that can afford for my child to do. Next is parents say, I'm exhausted, and I need something to do to entertain my child while I try to get things done. The next is need to get things done. Next is bad weather. They can't go out and play because it's bad weather. And then the last is that they perceive that their neighborhoods are dangerous, that there's either real danger or they perceive that there's danger in their neighborhoods. So that's why they disobey the recommendations that their pediatricians advance. Next slide, please. So I told you how much children under the age of 5 are watching TV or looking at screens. Now I want to talk about children 8 to 18. So there was a very recent study done in 2019. This is the best study that they've done so far on tween and teen media use. They looked at 1,600 American children ages 8 to 18, and they divided them into 2 groups. Tweens are 8 to 12-year-olds, and teens are 13 to 18 years old. And they compared this study to their previous study that they conducted in 2015. Next slide, please. So what did we find? Actually, how much time are children actually watching screen time? The tweens are watching more than 4 hours of screen time per day. And again, remember the recommended dosage is less than 2 hours. And teens, more than 7 hours of screen time per day. And that does not count their school screen time. And I'm going to grab my mic, I think. And I can't see that far away, but I can see this. There's been a significant increase in everyday online video viewing since 2015. As you can see up there, 2015 it was 24% for tweens, and now it's 56%. 2015 it was 34% for teens, and in 2019, 69%. Television viewing has gone down, actually, looking at the actual video television. 25 minutes or less are what tweens are watching, and 24 minutes or less are what teens are watching. Smartphone ownership has increased exponentially, as you can well imagine, and so gone up to 67%. Gone up to 84% in teens and gone up to 41% in tweens. Next slide, please. All right. And so further, there is a phenomena called the digital divide. And that is that higher income teens and tweens have much more access to video materials than lower income children. But higher income children have less screen time viewing than lower income children. So children who have lower income, less than $35,000 a year for their families, are viewing television, tweens 5.49 hours a day in comparison to families with higher incomes where the tweens are viewing 3.59 hours per day. And teens of lower income are viewing a full-time job, more than 8.5 hours a day. They're looking at the screens as opposed to higher income kids, which is 6.5 hours a day. Social media daily use has not changed since 2015. It's about an hour and 10 minutes. And favorite digital activities of kids. So TV is the favorite in videos for both tweens and teens. Gaming is 31% for tweens and 22% for teens is their favorite activity digitally. Browsing the internet for tweens is next, followed by social media, and it's reversed for teens. Social media comes after gaming, and then browsing websites comes in at 8%. Next slide, please. All right. Internet viewing is different from boys and girls. So boys prefer to game, and they're 70%. And next is online videos, and finally is music. Girls like music best, and 73% of our girls are watching or listening to music online, next followed by videos, and then social media. And the daily use of computers for homework has gone up about significantly. So it's about doubled for both teens and tweens. All right, next slide, please. Okay. For socioeconomic status, I had mentioned already that there's a difference in screen ownership with higher income children, as you would imagine, having access to laptops and smartphones at a higher rate than lower income children, but 3/4 of low-income kids have smartphones. So smartphone ownership is almost universal at this point. We've noticed a decrease in reading for pleasure since 2015. And then the last thing that I want to talk about, common sense census, is that that monitoring. I want to contrast. So self-monitoring means that the child themselves are looking at how much time they're spending on digital devices. 15% of tweens monitor themselves, and 12% of teens. Parents monitor 28% of tweens and 14% of their teens. And that's monitoring the time. And then parents will actually monitor the activity of 50% of their tweens and 26% of their teens. And I would suggest that this is a really low number compared to what maybe should be happening. So does anyone know what the average first pornography viewing age is for children currently? It is 11 years old. And by the age of 14, 94% of individuals have been exposed to pornographic images. So having parents monitor the content of what their children are watching is probably a really good idea. Next slide, please. Okay, and then, so now we want to talk some about excuse me, I have the wrong slide here. Okay, so next we want to talk about the impact. So next slide, please. And I want to first talk about social skills development. So it was my belief as I was looking at the children that I treat that social skills seem to have decreased since my generation, or even since I started doing therapy with children a couple decades ago. So I wanted to take a look at this. So next slide, please. All right, so what I wanted to also put forth to give you all was that it's not all bad when we look at the impact of social media. And I wanted to give you a balanced perspective on what the research shows. In some sense, the research is very unbalanced because most of what the research is showing is that there is some danger to excessive digital media time, but it's not all dangerous. So some pros to social skills. Social media provides inclusion for marginalized youth, and this goes along with what Josh was saying earlier, but also can talk about, address kids who have developmental disabilities. It can address kids with physical disabilities, that this allows them to feel, to be in contact with other children and youth who have similar problems and not feel so isolated. Next, it can promote pro-social behavior. They can practice social skills in a less threatening environment and develop social skills. And it facilitates identity experimentation, and you can decide whether that's good or bad, but it certainly promotes that in an environment where they can practice it virtually before they practice it in real life, which might have some benefits. So some cons. It increases the risk of peer victimization. It generates social pressure involving coerced disclosure. So I've had a couple of patients who were court-ordered to see me because of sexting. Which is sharing sexual images of yourself over the internet. And in both of these situations, those images were coerced by the person at the other end of the communication. They were asking for those kinds of images from those children. And so this can definitely happen over the internet in a way that's much more widespread than it was in the past. It also enables maladaptive social interactions, bullying and hostility, and even avoidance. So one of the big diagnoses that I treat is anxiety, and one of the best treatments for anxiety is called exposure therapy, which does not mean the exposure as in pornographic, but it means having the child or adolescent or adult do the things that are not dangerous, that are typical for their age group, to make themselves do those things gradually, so that they learn that nothing bad will happen to them, and that they can then get used to it, habituate to that feeling of anxiety, and make that situation feel more normal to them. They practice. So digital media allows you to avoid those anxiety-provoking, age-appropriate situations, which then makes anxiety worse. It enforces anxiety. Next slide, please. So some more pros. 3 to 5-year-olds can improve their emotional recognition and empathy and self-efficacy if they view media with a parent or an adult. So those are shows like Daniel Tiger or Barney, things like that are slow-paced, that the parent can view with their child and discuss what's going on the screen with the child. And if they do that, that can help children of 3 to 5 years old develop those kind of ability to identify emotions and ability to help to identify with other people's emotions as well. Cons, less desire to leave the house, and that goes on with the anxiety situation, that what becomes comfortable to you is a very small world. And then the big world becomes less and less comfortable over time. More screen time for 24 to 36-month-olds led to poor performance on screening tests of social development at 36 months. So they are not getting that same practice that they would get if they were interfacing with other kids their age. Next slide, please. Okay, so now we're out of pros and more onto the cons with social skills. It increases aggression. So physical fighting and quarrels. If your child views screen time more than 2 hours a day, they're 42% more likely to get into fights. And total screen time of greater than 2 hours a day increases the risk of bullying by 30%. Playing at least some violent video games in the past year, there's a 4-time increase in the risk of bringing a gun to school. So definitely a risk of violence and aggression that we're seeing with increased screen time. Next slide, please. Not hanging out with friends. So there was a great study done by Jean Twenge out of the University of San Diego, and she did a study of pre and post smartphone. So smartphones were released or iPhones were released in 2007. And I'll be presenting to you several factors that she found. But not hanging out with friends as much. And so 12th graders in 2015 were going out less often than 8th graders in 2009. So definitely less socialization. Next slide, please. So is this a pro or a con? It depends on your perspective. Teens are dating less now, and so boomers. I'm just at the beginning end of Generation X. So baby boomers and Generation Xers. When we were seniors in high school, 85% of us dated. In 2015, 56% of high school seniors dated. So I'm in college again. I'm going back to the University of Dayton. I just started 6 weeks ago to learn Spanish. And one of the things that has happened in that time frame is a thing called the hookup culture. And I don't know if you are familiar. Some of you are nodding, and you know what that is. And so that is that there is very much more frequent sex without relationships happening in college. And what they're finding is that college students say they don't know how to date. They don't know how to interact with another person. They actually feel uncomfortable dating, and they jump right to sex. And so I think that I would say that less dating is a con of screen time, in that when we're in our parents' homes and have some additional protections by being having some monitoring in our parents' homes, then we can learn how to date, and we can start to develop dating skills in that safer environment, rather than being tossed into the college environment where we have less of those protections, and then we have to learn how to do that on the fly. And what's happening is that they're not learning how to do that. They're learning how to have sex without relationships on college campuses. Next slide, please. Okay. A pro is that actually teens are having less sex when they're teens, under the age of 18. So in 2015, the average age for first sexual encounter was the spring of 11th grade. In my generation, it was spring of 10th grade. In 2016, the teen birth rate has been at an all-time low. So it was down 67% from the modern-day peak of teen birth rate, which was in 1991. So our teens are not dating, but they're not leaving the house to have sex either until they get to college. Next slide, please. So health. What is the impact on our physical health? Next slide. So pros to physical health. It increases education about sensitive topics. So if a child has a rare genetic disorder, or a child has questions about his or her sexuality, things that are difficult to talk about with adults, you can find it on the internet, which might be good in some cases. It also can promote wellness behaviors. You can learn about how to be healthy on the web, and I do that all the time. I find out about how many grams of protein are in certain foods that I want to eat, and things like that, different workout routines. You can find that on the web. And it improves self-management of medical conditions. And I don't know how many of you have gone to the doctor, found out that your lab you have a lab result that's one way or another, and then gone home and Googled it and figured out how to manage that health condition. And so that's a positive. Cons, and these are two very important ones that I want to foot stamp: obesity risk and sleep interference. Of all of the things that I present to you today, the strongest research is that increased screen time increases exponentially the obesity rate in our youth and adolescents, teens, also our children and adolescents, and it interferes with sleep. And interference with sleep then has a number of secondary consequences, including obesity, but also academic problems and mental health problems as well. So definitely, there is actually no question, it's unequivocal that increased screen time increases obesity and sleep problems. It also increases consumption of unhealthy foods and decreases the consumption of fruits and vegetables. And that's mostly due to exposure to the advertising. Next slide, please. So I wanted to show the sleep slide. 57% more teens were sleep deprived in 2015 than they were in 1991. And sleep deprivation is linked to compromised thinking and reasoning, susceptibility to illness, weight gain we already talked about, and high blood pressure. And so what is normal sleep? I wanted to just give you that for your care recipients and their families. So normal sleep for 13 years old, 9.25 hours a night is what's normal for them. And that gradually increases. 18-year-olds should get 8.25 hours of sleep per night. Next slide, please. pros, children and youth are physically safer, which is interesting because I think the media would have us believe that things have never been more dangerous in the big bad world than they are right now. But actually, risks of violent crimes have gone down since the 90s. So it's much safer to send your children out to play now than it was in the 70s. But parents are very much less likely to send their children out to play alone than when I was a kid. Also decreases alcohol abuse in kids. Those are two pros. Cons, it decreases physical strength, including grip, leg extension, modified pull-ups, plank. It increases headache, it increases backache, and I want to foot stomp this as well. Physical activity does not compensate for the adverse effects of screen time. So you can't say, oh, I'm going to let my child watch 3 hours of screen time instead of 2 hours and then send them out for an hour to go play. And that hour to go play does not compensate for the damage that that extra hour of screen time did to them, health-wise. Next slide, please. Okay, now I wanted to talk about mental health, my wheelhouse. So pros for mental health. Again, just like physical health, it increases education about sensitive topics. It creates an opportunity for healthy sexual exploration before they're actually doing it with another physical body where they can get a disease or get pregnant or be otherwise at risk. It promotes healthy self-esteem and a sense of self via validation and acceptance. So I want to also put out there that some of these results are equivocal. So you'll see some similar things on the pros side and the cons side. And that depends kind of on how the researchers were asking the question. I'm consolidating research for you from 20 or 30 different studies that I looked at. And so sometimes you'll see a pro and a con on the same measure. But so I think that what they're saying here is that you can find your tribe on the web. And when you find your tribe to interact with, there's some validation to that. And we find that on Facebook and things like that, that you can find people to agree with you and who are like you. So that's a way that can be a pro for mental health. Cons, it promotes risk-taking behavior via super peer modeling. So you see those influencers on YouTube and other places. And if they're engaging in highly risky behavior, then children are viewing that and thinking that that is something that they could access as well. It definitely enhances the risk of sexual victimization. It further reduces self-esteem for boys. And the primary mechanism for this is how important video gaming is for a lot of boys and how competitive it is. And they compare themselves to other gamers and if they come out wanting in that, then that can really hurt boys' self-esteem. Also, being on the web excessively exacerbates loneliness. And increases emotional reactivity like aggression and externalizing behaviors. Next slide, please. So the one that we worry most about is suicide. And Josh talked about suicide with LGBTQ youth. This is just general youth. So the good news is that we've actually seen a decrease in suicide in youth since the 90s, since the peak in the 90s for boys. But from the low in 2007, which is when the iPhone was released, the suicide rate in boys has gradually gone up. Girls have borne the brunt of the rise in teen suicide rate. So females doubled from 2007 to 2015, their suicide rate, which was 2.4 per 100,000, and it was now 5.1 per 100,000. And that was the highest. In 2015, it was the highest rate for females since we started tracking it in 1975. In 2011, it was the first time in 24 years that the teen suicide rate was higher than the teen homicide rate. Next slide, please. All right. And then we had already talked about feeling lonely. And you can see just from that graph, that's Jean Twenge's graph, how starkly the rise is in loneliness since the release of the iPhone. Next page, please. All right. So some more, now we're out of pros. Some more cons. Not all digital media is equally damaging for self-esteem and depression. So the worst forms of digital media are social media and internet browsing. Less bad are internet gaming in terms of depression and self-esteem, and television viewing. Next slide, please. Okay. Oh, did I already? Is that the new slide? Did I miss one? Okay. All right. So I wanted to talk some about internet addiction. Can it be addictive? We know that drugs that are physically addicting, that you can have withdrawal from them and that they change the chemistry of your body. Can things that are not drugs be addictive? And there's been a lot of debate about that. I would argue that non-drug substances can be addicting, and that internet use is among the things that can be addicting. So they've done studies of high school students. There's a study, I think I might be out of order, but 224 high school students were administered the internet addiction test. And of the students that received that test, 24% of them had problematic internet use, and 1.6% of them had internet addiction. And there were a number of risk factors for that, including being male, more likely to have problematic or addictive behavior, attending vocational school, unhappy childhood, low self-esteem, problems in family and school settings, and conduct problems, which conduct problems are antisocial behavior problems. And so that I had shown that, or I had the slide on the internet addiction, that the World Health Organization has just come out a year ago with an internet gaming addiction diagnosis. That's the first internet diagnosis that has been accessible to mental health professionals. So, and they are saying that that it is an addiction. Internet gaming can be an addiction. Next slide, please. So interestingly, what they found is that the relationship between screen time and well-being is U-shaped, so that children who don't view don't view a lot, and children who view too much fare the worst. Moderate viewers, and that means children who are looking at the internet within the screen time that the American Academy of Pediatrics is recommending, so 2 hours or less, seem to do the best when it comes to mental health. Next slide, please. Okay, overall development. Next slide, please. So brain development, there are no pros, but there are cons for brain development. So early screen use has been found to change children's frontal lobe functioning. And when I say change, read impair children's frontal lobe functioning. What does your frontal lobe do? Your frontal lobe is responsible for your highest order human thought and reasoning. That's planning, it's understanding the consequences of your actions, it's being able to learn from your mistakes, it's the ability to sleep in order to store new memories. It's able to bring up a situation that you've learned in the past in a new situation so that you can remember what happened before and use that knowledge in the new situation. That is changed by early screen viewing. Next slide, please. All right, so in terms of academic development and cognitive development, some pros, 3 to 5 year olds, and I talked about this a little bit earlier, when they can view slow-paced, thoughtfully designed media with a parent, that can sometimes help with developing some literacy skills, and that's especially in low-income children. But children, and I'll bring this up in a second, I think it might be on the second page, young children do not learn well from screens. Children under the age of 2 or 3 don't learn as well from screens as they do from human interaction. So it's not as good, viewing a screen is not as good as teaching a child one-on-one or in a classroom setting. You can develop hobbies and interests on the internet or find other people who share yours. You can be creative and develop collaborative skill building on the internet. It exposes a child to new ideas. I have a family friend's child who learned about space from the internet, and this was not a bad thing to learn about. So this can be good things. Cons, the majority of the software programs and things that internet developers tell you is going to help your child develop. Like, do we all remember Baby Einstein? Do you remember? I don't know if you remember that, but they sold these videos of Mozart music and things jumping across the screen, and they said it was going to promote your child's cognitive development. It was not. It does not promote your child's cognitive development. So most of the things that the media is saying is going to help develop your children cognitively with media, it does not. Next slide, please. All right. Viewing digital media can improve visual attention, but only for video games, not for other ways of attending. So you would think that sometimes things would generalize and you would be able to view more things. Learning one skill in one context might help you in another context, but not so. In this particular case, you only get good at video games by viewing video games. Cognitive or viewing improved literacy on some test scores can be improved by the internet. It improves written English. It improves vocabulary, and they studied specifically Dora the Explorer for that. Co-viewing with an adult increases vocabulary, and they studied Barney and Friends for that one. Cons, more screen time in 24 to 36-month-olds led to poor performance on tests of behavioral and cognitive development at 36 months. It increases the risk of language delay. It reduces school readiness, so decreased vocabulary and number knowledge. It lowers IQ, and there's actually very strong research to support the lowering of IQ with increased screen time. Several studies confirm that and replicate that. Next slide, please. And in children, excessive screen, I skipped. Lowers GPA, lowers academic achievement, contributes to cognitive overload and multitasking errors. I think in about 10 years ago, actually, they came out with, you can't really multitask. Nobody multitasks, even if you think you do. What you do is switch between two tasks. And the more you multitask, the less efficient your processing is. So that's what happens when you do too much screen time. And kids who view too much screen time spend less time on homework, at least than my generation did. Next slide, please. In children under 3, excessive screen time precedes the development of difficulties. So it causes them. Oftentimes they'll say when you're doing a correlational study, you can't tell what came first. Did the developmental disability cause the increased viewing, or did the viewing cause the developmental disability, or was there a third factor? Well, in this case, research pretty strongly supports that viewing too much screen time promotes developmental disabilities. Next slide, please. So moving on to just varieties of things. Driving. Children are driving less. There's less of a press to drive. And I think the concept that is developing over the course of this presentation, I think, is that screen time, games, and screen content is so thoughtfully developed, and it's so engaging that real life can't compete with it. And so children are wanting to engage with digital media because it's just so much more attractive than real life. Next slide, please. Employment. Children are less likely to work. In the late 70s, 77% of high school seniors worked for pay, and in the mid-2010s, 55% of high school seniors worked for pay. So those are the impacts. Next slide, please. So who's at greatest risk? Young children, for sure. children and adolescents from marginalized social groups and ethnic minorities, children and adolescents from low SES families, children and adolescents with electronics in their bedroom. Next slide, please. And I'll skip that slide, but, well, no, actually, I'll do that and then move on to wrap up so that I want to make sure you have time for questions. So, other risks. So, people who are at most risk for problematic internet use, becoming addicted, are younger adolescents, youth who identify as female, and though other studies say male, and pre-existing mental health conditions like obsessive compulsive disorder or attention deficit hyperactivity disorder. Youth who are you're more likely to get depressive symptoms from internet viewing for youth who already have mental health conditions, or who engage in passive and comparative internet viewing use, so that they see kids and other adolescents who they think are more attractive, have a better life, are more talented than they are, and that they can never compete, they can never measure up. And I definitely see this in the kids that I work with. Cyberbullying, kids are more at risk for that. LGBT plus youth, teens on the autism spectrum, youth who are bullied offline, and youth who have bullied other people. And then risky sexual behaviors, youth with a history of impulsivity, substance use, youth who score higher on sensation-seeking measures, LGB youth, and youth who identify as female are at the greatest risk. All right, so I have several more slides, but I think I want to skip to recommendations. So I'll just have you, yes, okay, so recommendations for caregivers. I wanted to have, and I understand that you guys are giving care to parents and of adolescents and might have some advice. So I would say, here's my prescription for you. Consider that they should make digital media use a standard area of inquiry, or you should make digital media use a standard area of inquiry. When you ask about what's going on with your caregivees, teens or adolescents, how long do they spend on electronic media a day? Do they have a TV in their bedroom? Do they use electronic media during meal times? They can use providers can use objective measures, and that there is one in your handout, the PRIUSS. It's a public domain way of assessing media use. Encourage parents to set consistent and age-appropriate limitations on screen time, like using the family media plan, and I included that in your handouts as well, how parents can access that and sit down with their kids and come up with a media plan for what's okay and what the limits are. Encourage parents to limit screen time during meal times. Next screen. Discourage parents from allowing their children and adolescents to have electronic devices in their bedrooms, and this is mostly for sleep. And you may know this already, but the light from flat screens emitted imitates sunlight. And what sunlight does is degrade the melatonin that your body naturally makes, which then makes you sleepy for bedtime. So we recommend that kids don't look at screens we recommend nobody looks at screens 60 to 90 minutes before bedtime so that your melatonin can build up and you can get sleepy. So no screens in their rooms. Encourage parents of young children to co-view media and involve authorities when you're concerned about online sexual abuse or exploitation. Next slide. Recommendations for parents, create and devise a family media plan. And it's really easy to do. The website that I recommend to you is really a really easy thing to use. Actively learn about the apps that your child is using. My sister-in-law is a friend of her 18-year-old daughter on all of the apps that she uses. So co-view, friend, and follow your child within the context of your relationship. I have another friend who spies on his kids on the internet, and I don't recommend that. I really recommend that your child knows that you're looking at their, following and monitoring their internet use, and so that you're doing that within the context of your relationship with them, not as a police force for them. And communicate continually about online citizenship and safety, including local laws for your children. Like my patient didn't know that sexting was illegal. So she should have heard that from her parents. And also youth don't understand about the impact that what they put out there on the media is forever. You guys know that. And so when they go to apply for college or a job, colleges and jobs now routinely Google their applicants. And whatever inappropriate content is out there is out there. Next slide. Build a part of your relationship with your teen around social media use. Model healthy media use, and this is really important. I think sometimes we are not exemplifying healthy media use, and we're taking our phone to bed, and we're spending more than 2 hours a day on media, and we should model that. Do not ban social media altogether. Instead, help your children, tweens, and teens think through what constitutes healthy, happy media use. Next slide, and this is recommendations for teens and tweens directly. Use social media, tell your teens and tweens, use social media in moderation. If you use media, use it along with other interests and healthy behaviors, such as adequate sleep, physical activity in school. Think about your actions before using social media, especially if you're in a bad mood. And use social media with your digital reputation in mind. So I didn't talk about dosages today, but the undergirding message in my slides about dosage is more is worse. The more media that the child is exposed to beyond 2 hours a day, the more aggression, lower academic performance, more health problems, more depression, more suicide happens. So that therein lies my presentation, and I am happy to take whatever questions people have.
Nobody on the screen at home will hear you. Just a minute.
I just had a question with some of the changes in socializing and all that, and driving at an older age, dating, some of those types of things. Do you feel all those are related to internet usage? I mean, I have just wondered if some of all the extracurricular activities kids have and the busyness of kids, how much of an impact those things had as well, or is it just internet?
That's a really good point. So I think that in Jean Twenge's research, that where most of that was, where she found most of that, she was looking at 2007 being the dividing point, and that was the increase in smartphone use was the big factor that made the big thing that changed. I don't know that teen activities, sports and things like that had increased that much after that point in time. So I would say that that the bulk of the variance can be attributed to increased internet use. Maybe not all of it, but the bulk of it can be. Good question.
This isn't a... Any other questions?
Okay.
My grandchildren are 5, almost 6, my youngest, and 1, almost 2.
Yes.
They each own their own tablet.
Yeah. Yeah. Yeah, so the advice of as a concerned grandma would be to your children.